So the current treatment paradigm for newly diagnosed myeloma utilizes the standard convention of using induction therapy followed by stem cell transplantation for those who are transplant eligible, followed by maintenance therapy. This paradigm has been tested in a multitude of clinical trials, and all of these trials have showed impressive outcomes. Having said that, a lot of questions have been raised as far as maintenance therapy post transplantation. The randomized trials often have limited follow up time, making it difficult to assess long term outcomes like overall survival. And trials also have strict inclusion criteria that may not reflect the real world patient population. The real world data enables assessment of overall survival in larger, more diverse patient cohorts treated in routine clinical practice. This involves aggregating patient data from electronic health records and other sources, structuring it into analyzable data sets, and conducting analyses. So at Hackensack John Theurer Cancer Center, we utilized COTA's real-world data platform to uncover insights about real-world treatment patterns, as well as outcomes across all of our multiple myeloma patient population. And this enabled us to identify best practices associated with superior outcomes and areas for quality improvement, and deploy evidence-based approaches to enhance the delivery of care. So in our abstract, we compared the effect of maintenance therapy in the real-world setting compared to those who did not receive maintenance therapy post-stem cell transplant. The most commonly utilized maintenance therapy was lenalidomide. We identified 1,934 patients who were eligible for the study, of whom 957 patients received maintenance therapy post-transplantation, and 971 patients did not receive any form of maintenance. There was no impact on overall survival with the use of maintenance therapy, with the arm not using maintenance therapy showing a trend towards improved overall survival rather, at 126 months, compared to the maintenance approach, which showed a median overall survival of 108.8 months. The time to next therapy with maintenance Revlimid or lenalidomide was also longer as expected at 51 months compared with 36 months without the use of maintenance. However, the arm that did not receive maintenance therapy had an improved time to next therapy following relapse at 21.6 months compared with 11.7 months for the maintenance arm.